Hello, my name is Ella Ream. Today I'm going to present an article titled Opicapone as an Adjunct to Levodopa in Patients with Parkinson's Disease and End-of-Dose Motor Fluctuations. The null hypothesis of this article is that there is no difference in the treatment when opicapone is used with levodopa. There were two reasons why I chose this article. The first was because I have a friend who recently developed Parkinson's disease, and I've seen what it's like to have those symptoms during the off time. Secondly, this article demonstrates that there is room for improvement in the off time. The primary objective of the article was to assess the efficacy of opicapone. The secondary objective was to assess the proportion of patients that had at least 1 hour of reduction in off-time symptoms. The methods used, this was a randomized, double-blind, placebo-controlled, and active-controlled trial. The drug used in the active component was entacapone. Inclusion criteria, the patients had to be between 30 and 83 years of age. They had to have had Parkinson's disease for at least 3 years, and they had to have had successful treatment with levodopa for at least 1 year. Exclusion criteria were that patients had been treated with entacapone in the past, that they had had deep brain stimulation for Parkinson's disease treatment, or that they had severe and unpredictable off-time symptoms. This was a per-protocol method. Patients had to have at least 1 dose of the opicapone, placebo, or entacapone and had at least 1 episode of off-time symptoms. They assessed these using patient diaries. There could be some compliance issues here. However, the data showed that it was significant and it matched the results. The placebo group included 600 patients, and the active group included 537 patients. These patients were from 19 different European countries, as well as Russia. The primary outcome was statistically significant with a p-value of 0.0083. They found that 50 milligrams of opicapone had a mean reduction time in the off state of 60.8 minutes versus the placebo. The secondary outcome was a global assessment of the placebo versus the active control and the opicapone. The opicapone, as stated previously, had 60.8 minute reduction, while the entacapone had 40.3 minute reduction in off-time symptoms. This was also statistically significant with a p-value of 0.001. Thank you very much.